Good afternoon. I'm George Latimer, Westchester County Executive, and we're here today to talk about a terrific initiative that takes some of the best professionals that we have in Westchester County and joins their forces together as an outreach to deal with opioid addiction here in Westchester County and the response and dealing with the overdose prevention efforts that have to go on in order for us to deal with the opioid crisis that we've faced, not just in Westchester County, but in this country. I'm joined today, and you'll hear from each of them, by our terrific district attorney, Mimi Rocah. We also have with us Michael Orth, who's the commissioner of our Department of Community Mental Health, Dr. Sherlita Amler, Commissioner of Health, and also Terrance Raynor, who's the Deputy Commissioner of Public Safety for Westchester County. Each of them are at the top of their respective responsibilities and professions, and it takes a combined effort between each of their expertise in order for us to have the kind of response and result that we expect to get from this initiative, which we've used the acronym of ORI to represent our response for this. So to explain the initiative, I'd like to ask our District Attorney, Mimi Rocah, to start the process. It's been much of her vision that has helped make this happen, and we're grateful to her for her leadership in this area. Madam District Attorney.
Thank you so much. We are here today because too many families have lost loved ones to drug overdoses. Too many young people have struggled painfully with substance abuse. And too many of our communities have shouldered the burden of this crisis, facing crime and sometimes violence driven by illegal trafficking of opioids. The opioid epidemic is relentless, and it demands an all-hands-on-deck response. And that is exactly what we have here today. Cooperation and coordination amongst different parts of government, law enforcement, public health experts, mental health experts, and community partners. The Overdose Response Initiative, or ORI, will focus for law enforcement on timely communication and a greater emphasis on data sharing and enforcement with local departments. Together with our law enforcement partners, like the County Police Department, my office is and will be working to disrupt illegal opioid distribution networks throughout Westchester. Time after time, we have seen people with real pain issues become addicted to opioids and then turn to cheaper and often more readily available alternatives like heroin, which is commonly laced by dealers with an even cheaper, more potent, and more deadly synthetic opioid, fentanyl. Other street drugs, like cocaine, are also mixed with fentanyl by drug traffickers, and this has played a significant role in an increase in overdose deaths. Under the ORI announced today, we will specifically target those individuals who supply these dangerous drugs, whether they are medical professionals or dealers on the street. Individuals who try to make a profit by taking advantage of people suffering from substance use disorders will face criminal consequences wherever the law and facts allow. And let me be clear, we will be especially focused on individuals who prey on minors. At the same time, we will work closely with our partners in the public health and social services arena to provide pathways to ensure the most effective use of Narcan to save lives and to ensure treatment for people who are dealing with substance use disorders. This dual approach, law enforcement, social services, treatment, mental health, is the most effective way to combat this crisis. I thank my partners, County Executive George Latimer and his team, the Commissioner of Community and Mental Health, Michael Orth and his team, the Commissioner of Health, Dr. Sherlita Amler, and the Westchester County Department of Public Safety, Commissioner Gleason, and Chief Raynor. I also want to thank my Chief Criminal Investigator, Dan McKenna, who's not here today, but he has been a leader and committed to this effort in getting it off the ground. Thank you.
Thank you very much. That's our District Attorney, Mimi Rocah, and we benefit greatly from her leadership in these areas of prosecutorial functions as a former federal prosecutor with an academic credential as a law professor, and now bringing those things into the District Attorney's office. We're deeply grateful for what you and your team adds to a very important element. And what she pointed out is that to effectively have this initiative, we need to mesh the prosecutorial function from the police law enforcement function, the mental health function, and the public health function. And that's why each of these other individuals are each going to talk a little bit about their involvement in this effort. Michael Orth is our commissioner for the Department of Community Mental Health. He's been a leader, not just in Westchester County, but across the state. Many times I'm reached out to by my colleagues, other county executives or leaders of other counties, because they're impressed by something that our Department of Community Mental Health is doing that is setting the bar higher than might be in other places. And we owe that to Michael and his professionalism. And in this particular place, applying those skills to this particular very difficult area of public policy, we're grateful for his leadership in this area. Michael.
Thank you. Appreciate it. Good afternoon. Let me begin by acknowledging the leadership of our County Executive George Latimer, District Attorney Rocah, who have made this a top priority and promoted the collaboration between county departments, local municipalities, and community stakeholders. I have the pleasure of serving as the co-chair of the Opioid Response Initiative, along with Department of Health Linda Hakeem. I'd also like to acknowledge from our department Joe Glazer, Deputy Commissioner, and Trevor Payne, who have been critical in moving this initiative forward. Again, I also want to thank the county executive for pulling us together as county departments, and that includes Department of Health, Community Mental Health, Public Safety, Department of Social Services, the Medical Examiner's Office, and of course the District Attorney's Office. So thank you for setting the charge and tone. ORI brings together committee members who have an expertise, who have a skill set, who bring their resources to the table to address the opioid crisis and ultimately saving lives. This ORI serves as the primary strategic county planning body for our response to the opioid epidemic. We have all seen the need before and since the pandemic as it relates to opioid and overdose. Tragically, many of our residents have been impacted by opioids as a result of pain treatment, management, traumatic stress, addiction, and co-occurring mental health substance misuse. Just as any other public health issue we face as a society, opioid overdose response must include awareness, prevention, early intervention, and access to effective and evidence-based treatment and recovery supports. As a committee, we do this not only between county departments, by community, advocates, residents, and of course our stakeholders and service providers. Just want to highlight some of the examples in charge of our ORI committee. One of the areas we've collaborated around is data collection and using that data to target our resources, our interventions, and how we can best apply best practices. We're using data from police, from the emergency departments, and from service utilization, all coming together to look at that data to make sure we're collaborating and coordinating our resources. You'll hear more about some training in terms of Narcan from Dr. Amler, but we're also doing community education and outreach, whether it's using best practices like co-occurring disorder, CODA, in school districts, mental health first aid, teen intervene, and of course supporting family members and loved ones who are often in the front lines experiencing the pain and suffering by their family member. An important role that we play as the Department of Community Mental Health with our stakeholders includes increasing access and evidence-based substance use, mental health, and co-occurring treatment for our community. That includes medication-assisted treatment wherever the individual may be, whether it's in the community, whether it's in the county jail, or elsewhere, using person-centered planning, use of peers, and thanks to our county executive and our board of legislators, we're about to roll out mobile crisis teams throughout Westchester County, serving individuals who have mental health and/or substance use issues, including opioid challenges. Thanks to the district attorney, we're also offering diversion efforts, a program called Fresh Start that gives people an opportunity to seek treatment. And finally, our 911 dispatch training, thanks to public safety, we're actually identifying people who are struggling with mental health issues and directing them to the appropriate services. Again, I want to thank our committee members for their commitment, their hard work, in making the difference in many of our residents' lives. So thank you.
Thank you very much. That's Michael Orth, Commissioner of our Department of Community Mental Health. Next, I'm going to ask our Health Commissioner, Dr. Sherlita Amler, to join us here. You've seen Dr. Amler now over almost exactly 2 years, take on the responsibility of leading our charge on COVID response. And to the extent that we in general government have to make decisions, we make them with some of the best advice that we could possibly get. Her background as a pediatrician and heading up the health department in neighboring Putnam County long before she started here in Westchester County has really advantaged us over the period of time. I know that we always act on her advice, but we always listen to it with great importance. And she, in this particular role, brings that issue of public health to join the other disciplines that we've just talked about. So, Dr. Sherlita Amler.
So first of all, I want to thank the county executive for his leadership in this very important initiative, and also our appreciation to the DA, Mimi Roper, and also for the commissioners Gleason and Orth. They've always been really great partners to the health department. So as you have heard, the Westchester County Department of Health and all of our partners have been collaborating for many years to address the opioid overdose epidemic in our county. Throughout the partnership that we've had for many years, this ORI has been developed, and we've been able to watch this initiative grow to include the representation that it has today, and it's been a really rewarding experience, I think, for all of us. The health department's opioid prevention initiatives really began back in late 2014, in which we started outfitting police officers with Narcan, which actually meant that I was going from police department to police department, training police officers to use and administer Narcan, and for them to then train other officers. And as you can imagine, this, when we first started, this was not widely greeted with great enthusiasm, because police officers said to me, you know, Dr. Amler, I'm not a physician, I'm not a nurse, I didn't go into, being a police officer to deliver medications, but once they saw the value of Narcan and how it literally could save lives, people's lives right in front of them, they really jumped onto the bandwagon, and they have been some of our greatest allies in this battle. Police officers, unfortunately, are often the first person to arrive at the scene, and before we had Narcan available to them and the training so that they would know how to properly use it, they unfortunately sometimes had to just watch people die before their very eyes. And now we know that, with the use of this drug, which I have to say is different than most other drugs that we administer. Narcan, I honestly couldn't say that I would get police officers to give this drug if they had to start an IV or give a shot. But Narcan is one of a few drugs that can actually be administered by squirting it up someone's nose. And it's as simple as taking out a syringe full of Narcan and just inserting it into their nose and pushing the plunger, changing it to the other side and pushing again. And literally, you can have somebody who is not breathing, their heart is not beating, they are clinically dead, and within minutes, they're setting up, talking to you as if nothing ever happened. So this drug is really like a miracle drug. And I think that more than anything, it has helped the police department and the community come together in this battle where they can be seen as the true heroes that they are. So in June of 2015, we also expanded our Narcan training into the community. We were getting a lot of people in the community saying, Dr. Amler, I understand that the health department is training police officers, but I have a family member who suffers from an opioid addiction, and or just a drug addiction, and I really am afraid to go to sleep. I'm afraid that I'm going to find my child dead. And so I'd love to have this training. And so we actually started offering the training to the community. And what a lot of people don't understand is that Narcan really only works against opioids. But as you heard, a lot of times drugs are laced with opioids, especially fentanyl. And fentanyl increases the risk of an overdose occurring when it is in a drug mixture. So what Narcan can do is it won't take away drugs that are not opioids, but sometimes it can remove enough of the opioid from the receptors in the person's body that they will then be able to breathe on their own. So it's a great drug, and as I said before, it has almost no side effects. And if it's not an opioid overdose, it won't harm them. So you really have nothing to lose by giving this drug. So we started training just family members and local community people, and in addition to that, professionals. We trained pharmacists, we have trained school nurses, a wide range of people who are professionals in our community to help us get the message out about Narcan. Trainings can be held in a group setting, or sometimes they're just one-to-one in non-traditional settings, such as street corners in neighborhoods where we have people who use drugs and congregate there, and this may actually be the community in which they live. So it's very important that we actually get these drugs, get the Narcan to the streets where people live. To further expand access to Narcan, we are also coordinating with the Department of Community Mental Health, Social Services, and Public Safety to develop a new pilot program to install naloxone boxes at homeless shelters and facilities, homeless shelter facilities. Naloxone boxes house Narcan kits, and so they're just boxes that can be attached to a wall, and before, people would have to actually find somebody, whoever had the key to the Narcan, and you really only have a matter of minutes when somebody is overdosing to get the Narcan into their system, or it'll be too late. So by putting these boxes where they're readily accessible, someone who needs it can simply reach in, get the drug out, an alarm will sound so that the administration of the facility knows that it's been accessed, but the bystander can then deliver the Narcan on the spot. So stay tuned, as more information about this new initiative is going to be coming soon. With the rise in fentanyl, the health department has also begun to distribute fentanyl test strips, along with this newly created How to Test for Fentanyl guide to clients of the Urban League of Westchester's Urban League of Westchester Syringe Exchange Program. Fentanyl is a very, very strong drug, and it is a synthetic opioid that, because it's very cheap to manufacture and because it's very potent, is often added to street drugs unbeknownst to the user. These test strips will allow clients to check their drugs for the presence of fentanyl so that they can take steps to reduce their risk of an overdose. All of these are just some examples of initiatives that the health department has undertaken to help prevent opioid overdoses in Westchester. Going forward, the unique expertise of the ORI representatives here is going to help us gain valuable insight into the ways we understand this problem and permit us to make even greater strides, we hope, in our overdose prevention efforts. And I really just, again, want to thank all of my partners, but most especially, I want to thank the county executive for his leadership in this, because since we started giving out Narcan, the county has literally saved hundreds and hundreds of people. All of these people now have the opportunity to choose to try to get into rehab, to try to get help that they would not have the opportunity for had they not survived their overdose. So again, just thanks to everybody involved. We really appreciate it.
Thank you very much, Dr. Amler, and we owe you a debt of gratitude that we can't repay for all of the leadership that you've shown through this and other health crises, and we appreciate that leadership, that professional leadership. Our last speaker, although I am going to invite the district attorney to close in a few seconds so that she has the ability to pull some of these things together. Terrance Raynor is with us today as Deputy Commissioner of the Department of Public Safety. We commonly call it the County Police. Commissioner Thomas Gleason is out of town on business, so he's unable to be with us today, but the Deputy Commissioner is a great leader in this department. He began his career in the city of Mount Vernon as a police officer, walking the beat and driving the beat, worked his way up to the top leadership in that department, and we're very fortunate to have him in this role as Deputy Commissioner, where he's taken on a number of different assignments and really given us a very practical mindedness in the way we go about our police work, and that's part of the reason why we are both fully funding the police and doing the reforms that are necessary at the same time and in a harmonious way. So we thank him for his leadership, and we welcome him here to the microphone. Terrance Raynor, Deputy Commissioner of the Department of Public Safety.
Thank you, County Executive Latimer. appreciate the kind words. And on the law enforcement side of this opioid epidemic, one of our biggest challenges has been the introduction of fentanyl into the illicit drug market. Fentanyl is a synthetic opioid, which you heard, and it's 80 to 100 times more potent than morphine. Because of its powerful opioid properties, fentanyl is used to increase the potency of heroin. More recently, we are seeing fentanyl in cocaine, and it's being pressed into pill form and sold as Valium, Xanax, and other sedative type pills. A relatively small amount of fentanyl can and will cause respiratory depression and lower blood pressure, leading to overdose. Many drug users don't realize the product they're taking contains this deadly substance, which is the leading cause of overdose deaths throughout the country. Hence, the need for first responders to continue training in the use of Narcan in hopes of saving lives. The county police remains committed to working with our law enforcement partners, both locally and federally, as well as county agencies represented here today, as we address the flow of this and other illicit drugs into our communities. Working with our law enforcement partners has led to the seizure of more than 11 pounds of fentanyl, 12,000 fentanyl pills, 20 pounds of heroin, and 2,000 pounds of cocaine in 2021 alone. In addition to our enforcement activities, investigators assigned to our real-time crime center continue to coordinate with the district attorney's office and local police departments to collect timely and accurate data regarding overdose cases throughout this county. The data is evaluated and used to direct law enforcement investigations and the county's community outreach efforts by our partnering agencies. With that, I want to thank again the county executive for his leadership in this initiative, and I also want to thank all of our partners throughout with the county agencies who are working towards making this a better county for us all. Thank you.
I want to check to see if we have any questions from the press on any of these topics. Any member of the press that may be picking this up as a feed, we certainly invite press to attend, but we know that in person is still, a matter of subjective comfort. So we're happy to have you reach out, and if you'd like to speak to the district attorney or to any of the commissioners here that are part of this, we welcome that as a follow-up to this story. And we have a little bit of in-present press in the room, and you're welcome to interview individually the district attorney after this is over on this topic. I'll make a few comments and I invite the district attorney to make the final close on this. We talk about public policy proposals and plans, and sometimes because we try to approach it from a level of intellectual explanation, so you know what it is we're doing and how it is we're doing, and we have people with a variety of expertise that approach this problem from the different angles of it. Sometimes you forget that there's a human side to this. It was touched on a little bit by some of the things that my colleagues have said. But at the end of the day, I think of a friend of mine who lost a son to opioid overdose in his 20s. And, as any of us who've been parents, who are parents, when you see that young child grow up in your house and grow up to maturity, when they get the high school diploma and they go out into the world, you have this great sense of accomplishment because many of your hopes and dreams are now reside in your children. To have your child die tragically at a young age is difficult enough, and to know that it happened because of a drug overdose is even more tragic. It's a loss that wasn't necessary. I don't know that we as humans will ever truly understand what motivates people to move in the direction of a drug addiction, but all of us can understand what it's like to have some version of an addiction that we have to overcome. For some of us, it's food and our weight. For other people, they have to deal with the use of alcohol in their life or other things. But drug addiction has a very dark and deadly side, which has been outlined by each of these speakers. So when our district attorney steps forward, joined by our Commissioner of Health, our Commissioner of Mental Health, and our commissioners of public safety. And we pulled this thing together to try to deal with this. We recognize this is a very hard issue to resolve. But we have to make a bold statement, and I think that's what this is. This interdisciplinary effort is to try to save that other person who has a son or a daughter who's in jeopardy from suffering, from going through this and then losing their life, and then causing ripples all throughout the lives of their family members. That's what we're trying to prevent with this. And we may fail in individual situations, but every one that we save is a success story. And that's how this initiative is going to be judged. Not where did we lose people, but how many did we save? How many people were we able to bring back from the brink? And I have confidence that this effort will give us that best opportunity. And when those people can come back from the brink, they rejoin society through rehab. They become productive members of the society. They participate in this wonderful county that we have, and not because it's a county, but because it's living life and being able to have families of their own and grow and thrive. That is what this goal is. That's why we pulled these resources together. So I'd like our District Attorney, Mimi Rocah, to make some closing comments, and then we'll thank you for your time and attention. So I give you, once again, District Attorney Mimi Rocah.
Thank you, County Executive Latimer. I said before, and I'll say it again, the opioid crisis demands an all-hands-on-deck approach. And that's what we have here. And that is what is so remarkable about what we're doing here in Westchester. Each agency, office, department here represents a different kind of expertise. And every one of those expertise are needed to address a problem that, as the county executive said, is so complex. And we recognize that. So whether it is the hero police officers on the street every day who are now trained in Narcan and delivering it with remarkable success, while the number of overdoses has risen over the past couple of years, the number of deaths has not in Westchester, largely due to this miracle drug, Narcan. But we can't leave it at that. We have to try to get people at early stages into diversion programs, into mental health treatment, before these addictions become deadly. And that's where our Department of Mental Health and Community Services becomes so critical. And last, we must take a law enforcement and prosecution approach. People who deal these illegal substances, knowing that they are filled with deadly substances like fentanyl, must have consequences, and particularly ones who deal to young people. So the all-hands-on-deck approach, we should be very proud of it. I am. Thank you, and we'll apply it, I'm sure, to solve many other problems. Thank you.
Thank you all. Thank you.